Thank you very much for joining us. I am Leron Brummel, and we are talking about government's first year in office, and our focus now is on the Ministry of Health, and no stranger to us is Minister of Health, Dr. Frank Anthony. Dr. Anthony, thank you very much for being here with us. How are you?
Well, thank you very much for having me.
You've been busy. For the past year, everybody has seen you. If nobody knows the Minister of Health now, they've not been paying attention to what's been happening around now. Very busy. Government came in at a time of a pandemic, and you are at the forefront of that, of course, urging and giving all the information necessary for a population to be safe. Let's look at it from the human side first, and nobody takes the time to ask, how have you been coping with this entire thing?
Well, I think I've been doing fairly well. You know, my background really is in health. So prior to becoming the Minister of Health, I had worked before in the Ministry of Health for more than 13 years. And I worked in various areas of health, from being a medical doctor to working on projects and so forth. So I think I know the sector pretty well. And so it wasn't difficult when I came in for us to start reorienting our response to the pandemic. And also I come with a background in public health. And I think when you're managing a pandemic, it's important that you understand the dynamics of a disease and what you need to do to change that dynamic. And so I was fortunate to also have a team of good doctors around me that assisted me in working on turning around our response. And I think because of that, we have been able to save quite a number of lives. So yeah, it was very difficult at the beginning because when we came in, we didn't have testing capacity, we didn't have areas to treat people. We didn't have ICUs, we didn't have inpatient facilities, and so we have changed all of that. As you know now, our testing capacity is up, so we can do about 2,000 tests in a 24-hour period, PCRs. We have other forms of tests, antigen, and we have gene expert machines that we have put at the regional hospitals so that PCR can be done at those hospitals. We have also improved our inpatient facilities. So we have at each of our regional hospital capability of managing COVID-19 patients at those hospitals with ventilators and monitors and so forth. In addition to that, we have been able to bring on board the 𝐎𝐍𝐵 facility, which, as you would recall, when we came into government, it was basically a shell, and we had to fix it up, put in all the amenities in place, and then turn it into a hospital, find the staff to run it. So now we have right now, in that facility, we have about 200 beds. We have an ICU that is capable of handling 45 patients. And so we have been able to treat people. Initially, there weren't medication that was available for such patients. When the government came in, we bought remdesivir, which is an antiviral medication. We have adequate supply of dexamethasone, which is another medication that is being used. And of course, when we came in, there was no piped oxygen in the facility. So we had to make sure that those things were placed in the facility and so that patients can get regular oxygen supply. So we have come a far way in terms of our capacity to respond to COVID, not just centrally, but regionally as well. And of course, during this period of time, we have trained literally hundreds of doctors and healthcare workers to be able to detect and treat this particular disease.
You talk about that in the treatment and everything, and while you've put that system in place, then the stage you're at now is vaccination, trying to get to herd immunity. Are you satisfied with where we are as a country in terms of our vaccination rate?
Well, actually, today is a milestone because we were able to achieve 50% of our adult population receiving the first dose of a COVID-19 vaccine. And I think that's a very significant milestone for our country. We also have, as of today, about 26.5% of our adult population who has been fully vaccinated. Now, we're still a far way from where we want to be because we want about 80 to 85% of our population receiving the vaccine. The government of Guyana has been able to source vaccines, bring them into the country. We have vaccines that we got donated from Barbados, from the government of India, government of China, and we have from COVAX, which is a multinational kind of organization. And so with those donations, we have received a lot of AstraZeneca vaccine and Sinopharm vaccines that we've been using to do our immunization program here. In addition to that, we recognize that this is not going to be enough for us to immunize all of our population. And so we took the special effort, made the special effort of sourcing additional vaccines. And so we have bought vaccines from the African Union. These are Johnson & Johnson vaccines. We have bought Sputnik V vaccines, and we have also bought an additional set of Sinopharm vaccines. So we have enough vaccines for our adult population. And if we really want to exit this pandemic, then I'm urging everyone to make sure that they get a vaccine because one is available for you.
Interesting. That's a whole synopsis of handling of COVID. Do you anticipate at some point in time, and I know the president has alluded to it, we may need to start considering vaccination passports or vaccinations to ensure people are fully vaccinated, to have services offered to them. And then I see countries at this stage now saying which vaccines, travel vaccination, which vaccines they're you're supposed to have before you get to their country. Do you see us moving in this direction anytime soon?
So there is some level of vaccine hesitancy locally, and there is vaccine hesitancy globally. And that is being fueled by a lot of misinformation that is peddled on social media. And unfortunately, we have people who would look at these things, listen to these things, without verifying the fact, and it has confused many of them. So while we know from the science that these vaccines are protective and helping people to stay alive, a lot of people are confused and are refusing to take the vaccine. So we have to work on dispelling those myths and to get people to understand the importance of this. As you know from the evolution of this particular virus, you now have different strains of the virus. So from the original one that we had in Wuhan, you now have an alpha, a beta, you have a gamma, and now a delta variant. And in some countries you can have all of them. In other countries, we see that the latest one, the delta variant, is dominating, meaning that that is causing the most cases in some of those countries. And these viruses are more transmissible, meaning that they can infect people quickly. They're also capable of causing more severe disease. And also, if they cause more severe disease, it means that more people will die. And you would recall just a couple of days ago, President Biden saying that we are now having a pandemic of the unvaccinated. Mm-hmm. So among unvaccinated people, we are seeing more cases of persons who are getting sicker, coming into the hospital, and who are dying from COVID. Those who have been vaccinated don't have those problems. Even if they get infected, they are going to get a very mild form of the disease, and they don't have to go into hospital because it's very mild.
Right.
They're not going to be dying from COVID. So for that reason alone, we should really get people to be vaccinated. But unfortunately, there's that resistance. Now, one way of encouraging people to get vaccinated is that countries are now requiring that for you to travel to that particular country, you must have a negative PCR, plus you must show your vaccination card to say that you are fully vaccinated. If not, they're not going to allow you into their country. So that's just one level. In some countries, for you to access services, you have to be fully vaccinated. So if you're going to go to a restaurant and you're not fully vaccinated, they're not going to allow you to go in. If you want to go to the cinema and you're not fully vaccinated, they're not allowing you to go in. If you want to go to watch a football match or a cricket match and you're not fully vaccinated, they're not allowing you in. So more and more, the world is going to demand that people be fully vaccinated. And if you don't want to be vaccinated, then you're not going to be able to access the service. And as this attitude spread, I think it would dawn on people who are unvaccinated to go out and get their vaccines. But here again, many countries are not in the position that we are in Guyana.
Right.
And that is, we have vaccines for people. Many countries wish that they have the vaccines available to give to their population, because people in those countries would like to get a vaccine, but they can't because it's not available.
Yeah.
We have the vaccine. We have on a daily basis about 100 sites across this country that is operating to give people vaccine. And yet we have some people who are resistant. So we need to encourage people to get the vaccine. And I want those who have been vaccinated to talk to those who you know who are unvaccinated and tell them about the process. It's seamless, it's easy. You don't really get any kind of major side effects. Some people might get a little bit of pain at the site where you got the vaccine or a little bit of fever, but that's gone within a 24-hour period. So there's nothing to fear, and you have so much to gain by getting that vaccine.
By getting that vaccine. Minister, we spent quite a lot of time on COVID, and everybody's been hearing about COVID, but there are other areas that are happening simultaneously that we may have heard about, but not too much. Let's look about malaria and filaria, for instance. How are we with handling these?
Well, filaria is an old disease that has been around in our country for a long time, and we really wanted to reduce the burden of filaria. You know, people with filaria, you can get infected and it takes about 15 to 20 years before you start developing Bigfoot, right? And because we have had campaigns over the last maybe 15, 20 years to try to reduce the burden of filaria, we have had some levels of success. Our latest campaign has been to do mass drug administration, and we have gone to all the places where you have filaria, and we have administered these medication. And from our stats, we have about, on average, about 80 to 85% of the population will have taken these medications, which really means that by the end of the year, when we have a PAHO WHO assessment, we are on that road for the total elimination of filaria in Guyana. So they'll have to do this assessment during this year, and then probably in another 2 years to see if there's still the disease here, and then they'll be able to certify us that we are filaria free. So that's a big achievement.
Right.
In terms of malaria, we still have a lot of cases of malaria in Guyana, and we see them malaria cases predominantly in Region 1, 7, 8, and 9. And so the ministry has started a special program of giving out insecticide-impregnated bed nets.
Right.
And we have 95,000 bed nets that we're distributing to these communities. Early in the year, we started in Region 1 and Region 9, and we have distributed across those regions. We are now in Region 7 and Region 8, so they're going to be getting their bed nets as well. And we anticipate by doing this, we are going to see a significant fall in the cases of malaria. For those persons who are working in the mining sector, we actually have brought in special nets for hammocks.
Okay.
And in some cases, you get both the hammock and the net. So there's no excuse why you shouldn't be sleeping on a proper net to prevent malaria. But with this program, it is also going to help to reduce other mosquito-borne types of disease. So it's not only malaria. We'll see a significant drop in dengue. If there were residual cases of Zika and so forth, all of that would be eliminated because all these are mosquito-borne illnesses. And by using this one intervention, we can actually reduce the burden in about 5 or 6 different types of diseases.
Yeah. It's interesting. But so there's so much we can talk about. We're going to leave it here for now and perhaps have another discussion at another point in time. But best wishes for you going forward. I know it's been a challenge. I know you and your ministry and, of course, government have been working overtime to keep the population safe. So best wishes to you going forward, Minister.
Okay, thank you very much.
Thank you very much for chatting with us. We've been chatting with the Minister of Health, Dr. Frank Anthony, looking at a review in the first year of some of the major projects and some challenges. And of course, that would have been focused more on COVID-19 and keeping Guyana safe. I'm Leron Brummels. Thanks very much for joining us. And do remember to be safe.